Sean, you've come to see us for a multidisciplinary pain management program, and one of the really important things to do is to try and understand chronic pain or persistent pain. And it's a little bit more complicated than just the disc injury that you've told me about. So I just want to use this information sheet to explain that to you a little bit more. So in a normal person, so a person who doesn't have chronic or persistent pain, let's say they've got a back injury, so they bend over and they develop a back problem. And let's say it is the disc that's causing that pain. What happens in that patient is that disc creates a pain signal, and that pain signal goes up the spinal cord and reaches the brain. And when that signal reaches the brain, that's when you actually feel the pain. So when people have chronic or persistent pain, what tends to happen, and this sounds a little bit unusual, but there's a lot of evidence to show that this is what actually happens, is that pain signal, so let's say it's about a 4 out of 10, okay, coming from this disc. As it goes up the spinal cord, it becomes amplified. So something happens to the nerves that transmit that pain signal to crank that pain signal up. So it might start off at a 4 or 5 out of 10, and by the time it reaches the brain, it's a 6 or a 7 out of 10. Okay? And this is very common in persistent. It is. Well, you've told me that you've got pain that varies from sort of 5 out of 10 up to 10 out of 10. Yeah. So we think that you do have part of your problem is coming from the disc, but part of the problem we also think is coming from this sensitised nervous system. So I'll just explain that in a little bit more detail. So here's another diagram that essentially is explaining the same thing. So you've got the injured body part, so in this case the disc, and this is a picture of the spinal cord that's been sliced through, so looking down on the spinal cord. So you can see that pain signal coming in, and then as it goes up the spinal cord to the brain, it's amplified. Okay? The spinal cord is sensitised. But the other interesting thing about this is the mood centre of the brain. Okay? And again, even people without persistent pain or chronic pain problems, mood can have an effect on pain. So if you're running around the football field, okay, and you're all pumped up and positive, and you cut yourself, you don't actually feel it. Does that sort of ever happen to you when you were playing football previously? Sure. Yeah, so you get injured and you don't feel it. And that's because this mood centre, when it's positive, when you've got lots of positive sort of emotion happening, it sends a signal down to the spinal cord that turns this amplifier down. Okay? So this happens in people without pain. But conversely, and particularly with people with persistent pain, if they're feeling low or sad, more negative sort of types of emotions, that can send a signal down to the spinal cord and turn the amplifier up further. Okay, and you've told me, and your questionnaires have said that you are.
Yeah, I'm quite depressed sometimes, and that brings out pain as well.
So you have actually noticed that when you're feeling low, that your pain can be a little bit worse.
A little bit worse, yeah.
So this is not saying that the pain is due to you. It's not coming from your head. Okay? That's not what I'm saying at all. You do have a genuine physical injury, but that's a part of the problem. But you've also got this sensitised nervous system, this amplifier in the spinal cord that's cranking the pain signal up. And probably your mood, your low mood is having an impact on it as well. So when we're thinking about how to treat your persistent pain problem, we need to think about all of those three factors. Does that make sense?